I was introduced many years ago. Our listeners know that I'm on faculty at the Pankey Institute, and I had the privilege of meeting Dr. Pankey very early in my career. I met him in 1982, and he's really recognized for two specific areas, many things actually, but two things that kind of come to mind is many people consider him to be the father of modern day complex restorative dentistry. He was all about helping people keep their teeth, all their life. And that was at a time when most dentistry was a profession of exodontia. Dr. Pankey graduated in 1922, no, 1923 from Louisville, School of Dentistry in Louisville. And if you think about what dentists were doing in the 1920s, what were they doing, George?
That's 100 years ago. They were pulling teeth.
They were pulling teeth. And Dr. Pankey wanted to save teeth. And so he needed to learn about material and restorative and technique. And so many people consider him to be the father of modern day complex restorative dentistry. But he was equally passionate about what he called the behavioral side of dentistry, the people side of dentistry. And I'll never forget his impact on me. And when he discovered that I was interested in the behavioral side of dentistry, he offered to be a mentor to me. This was 1982. And he was a mentor to me for the next 7 years. He passed away in 1989 at the age of 89. For the next 7 years, he was a mentor to me in physical presence, but continues to be a mentor of mine today, posthumously, through his work and his teaching in the Institute. But what an amazing influence that he's had. But he introduced me to what he called the mastery ladder, like a fire ladder. And this is, I'll share this with you and I'll ask your reflection on this. And this is his data on the mastery ladder. He said, if you think of the various achievements in your career as being rungs on a ladder, the top rung in dentistry was what Dr. Pankey would call mastery. And mastery meant that you literally knew everything about the art and science of dentistry. You could provide it, you could teach it, you could write about it, you could demonstrate it in photographic evidence, and you truly were a master dentist. And his observation was that perhaps 2% of our profession will achieve mastery status. And George, I'll put it this way, you or I as patients would gladly sit in the chair of a master dentist knowing that anything that was done at the highest quality possible. But that's about 2% of the profession. Right below that was the second rung of the ladder from the top. And he called that letter, that rung, highly competent. In other words, these were dentists that were extremely competent at what they did. Not quite at the mastery status, but very, very competent. And again, we would probably sit in their chairs, in their treatment chair at any time, knowing that it'd be done extremely well. Below that was 36% of the dentists, and he called them students, but not students in the concept of being a dental student. That simply meant that they were ever interested in improving their skills, perhaps progressing to the point of becoming highly competent, and then perhaps even progressing to the point where they would become masters. And then at the very bottom rung of the ladder, sadly, it was the largest percentage, 54% were indifferent. They didn't care. Well, we know that none of our listeners are on that bottom rung of the ladder because they wouldn't be listening to the podcast. But what are your thoughts? I don't know if you've ever heard the mastery ladder explained that way, but what are your thoughts?
Yeah, so a couple of things. I mean, I think it's amazing that you actually got to meet Dr. Pankey. That's really great stuff. And what a wonderful role model that you had. You had the opportunity to work with him. And I also want to just comment and say that I firmly believe that clinical skills are fantastic, but you make such a great point that people skills and the ability to have that aspect of your practice mastered is so important to successful dentistry. And for all the things that you've done and what your work is involved in, I mean, I think you've made such a tremendous contribution along those lines.
Well, thank you.
In terms of the ladder, I mean, I think that's probably spot on. I mean, there's so many folks out there, I think, unfortunately, that just want to sort of chug along, but there is that middle group that's always striving to be better. And that's important. I mean, goal setting is important. So when we see that middle or third rung down of the ladder of the percentage that are always wanting to learn, that's the group that's going to eventually and hopefully make it to that top rung of the
Yeah.
ladder. And that's that's exciting.
Yeah. Yeah, absolutely. I feel the same way. I think one of the things that makes our profession so amazing is the passion that many dentists have to simply be better tomorrow than they are today. And, really seeking that out and really striving to ever perfect their skills.